In a constantly evolving world, accurate information is power. Our program offers you in-depth analysis of public policy, healthcare advances, and crucial research. Turn knowledge into action. El Bujo Investigador, your trusted source for leading the future of healthcare.
Hello, everyone, and welcome. Today, we're going to take a deep dive into Peru's health system, really giving it a full diagnostic to understand its incredible successes and its most serious challenges. Okay, let's get right into it.
So, on the surface, this looks like a huge success story. I mean, Peru has hit a massive milestone. Over 97% of its population now has health insurance. That's a phenomenal expansion of coverage over the last couple of decades.
But, and this is the big question, right? That brings us to the real heart of the issue here. While almost everyone in Peru is insured on paper, the reality on the ground, what it's actually like trying to get good, timely healthcare, that tells a way more complicated story.
So, we've set this up like a complete medical checkup. First, we'll explore the system of contrasts that really defines Peruvian healthcare. Then we'll look at the symptoms, that gap between access and reality. After that, we'll diagnose the underlying conditions, things like funding and resilience. And finally, we'll lay out a prescription for the future.
You really have to give credit where it's due. Peru has made some amazing progress, especially with getting coverage to rural and low-income communities. Just look at this. Between 2005 and 2022, insurance coverage in rural areas shot up from just 25% to 85%. But that incredible success story is kind of hiding some really deep structural problems that have been there for a long, long time. And the core challenge, the biggest one, is what's called system fragmentation. So what does that actually mean? Well, it means the health system isn't really one single system at all. It's more like a collection of separate siloed subsystems that barely talk to each other. You've got one network for people with formal jobs, a different one for the poor, and then completely separate ones for the military and police. This creates huge inefficiencies, and this is the key part, it creates massive inequality.
Okay, so how does a fragmented system like that actually affect people's lives? Let's take a look at the symptoms, the real-world barriers that patients run into when they're just trying to get decent care.
You can see this divide so clearly when you look at who's insured by whom. The country is basically split between two giant public insurers. You have 62% of people covered by the Seguro Integral de Salud, or SIS, which is for the poor and vulnerable. Then another 26% are in Salud, the network for formal workers. And these aren't just different insurance plans. We're talking about entirely separate networks of hospitals and clinics. It's like two different worlds.
And the consequence of that separation? Well, you get these shocking geographic inequalities. For example, in Puno, which is an Andean region with a large indigenous population, a full 40% of people say they have unmet medical needs. But in the capital, Lima, that number is almost half, down at 23%. Your ability to get care literally depends on your zip code.
These differences also create a kind of two-tiered system for how long you have to wait. In the SIS network, the one for the poor, the average wait for an appointment is about 17 hours. But if you're in the Salud network for formal workers, that wait time explodes to an average of nearly 5 days. I mean, that is a dramatic difference in how quickly you get seen, and it all comes down to which system you happen to be in.
And underneath all of this, there is a huge infrastructure problem. A staggering 59% of public health facilities are officially classified as precarious. Now, what that means is they are simply not equipped to provide adequate care, whether it's because of crumbling buildings, broken equipment, or not enough staff. It's a system that is stretched to the absolute breaking point.
Okay, so we've seen the symptoms. Now it's time to diagnose the underlying conditions. What are the systemic weaknesses in how the system is funded and run that just keep these problems going year after year?
A huge part of the diagnosis is just chronic underfunding. Peru invests only 6.2% of its GDP in health. Now, to put that in perspective, that's way less than its regional peer, Colombia, which is at 7.6%, and it's not even close to the OECD average of 9.2%. The system is just being asked to do too much with too little.
So, here's the crucial part. What happens when public funding is that low? Well, the cost gets pushed onto patients themselves. These out-of-pocket payments make up a whopping 27% of all health spending in Peru. This creates a massive financial barrier, which totally undermines the whole idea of universal coverage, because even if you're insured, care can be completely unaffordable. And the financial problems, they run really deep.
The way budgets are made is super rigid, which means you can't move money to where it's needed most. Public funds for the SIS system often don't even cover basic recurring costs like maintenance or salaries. Budgets are usually based on what was spent last year, not on what people actually need right now. And to top it all off, a huge informal economy means there's just less tax money to go around for public services in the first place.
So when you have a system that's underfunded and inflexible, it just has very little resilience. It can't handle a shock. During the COVID-19 pandemic, these cracks were blown wide open, and sadly, it led to the highest excess death rate in the entire region. The system is also struggling with long-term problems like the dramatic rise in dengue cases and a really worrying drop in childhood vaccination rates.
Okay, so after a pretty tough diagnosis, what's the treatment plan? Let's turn to the prescription for the future, which is based on a real, actionable roadmap to tackle these core issues head-on. The number one priority has to be tackling that fragmentation. First, let patients use facilities across both of the big public networks so they can get care wherever it's closest or fastest. Second, create one single, unified benefits plan for everyone. Third, strengthen primary care all across the country with a new integrated model. And finally, and this is so important, unify the data systems so a patient's medical history can follow them no matter which clinic they go to.
And the prescription doesn't stop there. The budgeting process has got to be simplified to be more flexible. The way medicines are bought needs a complete overhaul to stop the constant shortages. Peru needs a national strategy to get doctors and nurses out to the rural areas where they're needed most. And finally, there has to be a much bigger focus on public health and preventing diseases before they even start. You know, when you take a step back, the path forward really requires a fundamental change in thinking. The goal can't just be about getting an insurance card in everyone's wallet. The real challenge is to build a system that ensures every single person can get fair, high-quality, and resilient care whenever and wherever they need it. And that really leaves us with the final big question. With such a clear diagnosis and a detailed prescription on the table, can Peru build a health system that isn't just universal by name, but is truly equitable in practice? Thank you so much for joining us for this explainer. Be sure to follow our account for more deep dives like this, and we'll see you on the next one.